New research finds intermittent fasting could lead to a higher risk of cardiovascular death. In fact, people who use this weight loss strategy, the risk of dying from heart disease nearly doubles. Fox Medical Team's Dr. Mike is live this morning. So, Dr. Mike, this method has become very popular, but what are some of these long-term health risks that we're looking at here?
Well, first of all, Brian, I'm going to talk Italian to you. Forget about it. All right, this was a presentation of data. A lot of people have some issues with it. It looked at two points of data. It didn't account for what the people ate when they did intermittently fast, whether they smoked or not. So I've been doing this, Brian, for 4 years, and I'm still here. I'm a believer. I believe that intermittent fasting for some people works very well, and it lowers blood sugars, it lowers cholesterol, and it keeps your weight down. So if you're out there listening, this is a big sensational headline, but a lot of people aren't buying it, and I'm one of them. I don't buy it. I think there is a role for intermittent fasting.
That is good news because I use this as well. Now, there are different ways to kind of intermittent fast. Some people only eat for maybe 8 hours a day. Others maybe fast 1 day a week. Is there any kind of method of this that might be better than the other?
Well, Brian, whatever works best for you. There are certain people that shouldn't do it. I'm not a fan of people with diabetes doing it. I'm not a fan of pregnant women doing it. I think that certainly if you're going to do it, start off slow. Maybe miss one meal. A lot of people will eat for 8 hours during an 8-hour period. I eat one meal a day, and I kind of fell into it because I work so hard during the day, Brian. For 30 years, I haven't really had time to eat. My mother always said, have breakfast. That's kind of why I did that. But ever since some data came out showing the benefits, I've kind of kept to it, and it works for me. And it sounds like it's working for you.
It sure is. Well, another new study says if doctors prescribe fruits and vegetables like medicine, we can improve our health through diet alone. So if this is true, why aren't we seeing this happen more often?
I don't know. I have no idea, Brian, why it's taken 100 years for us to get to the concept where if we prescribe healthy living, fruits and vegetables, and getting people learning how to eat right and investing in their health 401k, that's going to promote health, and they'll need less intervention from people like me. If you do things that are good for your machine, you're going to invest in that future, and you can teach your kids how to eat right. So look, we're starting small with this, especially in areas of the city where you can't find fresh fruits and vegetables. You can find a lot of highly processed food that's got a lot of salt and fat, but we need to get our society across the board learning how to eat right and get in better shape, because we have a problem. Remember that phrase, Houston? We have a problem. We have a problem. We got to work on it.
I also remember that phrase, an apple a day keeps the doctor away. Thanks for joining us, Dr. Mike.